So a serious problem with the nerves occurs with a decrease in glutathione. So it's no surprise that sugar is the enemy. It's one of the many enemies that we face in life. But certainly it's something that we have control over. Processed foods are, because they're depleted in nutrition, have very low fiber, high in high fructose corn syrup or sugar. This really leads to a lot of problems. But what happens is that as we get an increase in sugar in the body, we get increases in inflammation, decreases in glutathione. And if this goes on for a long period of time, one of the outcomes can be Parkinson's disease. Parkinson's disease is directly correlated to low levels of glutathione. And it's why there's some medical doctors today that have their patients using glutathione IVs once or twice a week. And this can definitely improve someone's symptoms. It's not a cure for Parkinson's disease, but it can definitely slow down the progression and improve someone's symptoms. Of course, one of the most famous and well-known neurological disorders is going to be peripheral neuropathy, and that occurs from diabetes. So what happens here is, again, the high blood sugar levels lead to chronic levels of inflammation. We get a decrease in glutathione, impairment in circulation. And in the early stages of diabetic neuropathy, people experience a lot of pain, inflammation, restricted range of motion. Then if it progresses, it leads to ulcerations. And then if it progresses, it leads to amputation. So this is either one of these disorders is, both have terrible outcomes. You can die, of course, from diabetes or Parkinson's disease. So both are terrible and they're controllable. So we don't have any studies on using X39 and Eon to treat Parkinson's or to treat diabetes. If people were going to use those patches to help support the overall health of the body, then I would say those would be the correct choices. One strategy would be to use X39 and glutathione during the day and to use Eon at night. And what they might find is that they get a reduction in the pain and inflammation associated with the neuropathy and with the Parkinson's. There's other things that they can do. We have over 70 studies on pulsed electromagnetic field therapy and 2 human studies on the use of magnetic field therapy in the treatment of peripheral neuropathy. And also we have some experience with Parkinson's disease. So the good news is that there are some unconventional means, specifically energy medicine, magnetic field therapy, that can reverse both Parkinson's and diabetic neuropathy.
So when we talk about both these patches together, if someone is coming in and just starting, is there a particular patch placement and timing you would recommend for the combination of X39 and Eon?